My name is Manjeet Kaur.
My name is Gurmat Singh.
Welcome to the One Show. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.
बहुत एक निੱਘਾ ਸਵਾਗਤ ਹੈ ਅਕਾਲ ਚੈਨਲ 770 ਤੇ ਸਕਾਈ ਔਰ ਫੇਸਬੁੱਕ ਤੇ ਲਾਈਵ YouTube ਤੇ ਜਿੱਥੇ 4 ਲੱਖ ਤੋਂ ਜ਼ਿਆਦਾ ਫਾਲੋਅਰ ਔਰ ਫੇਸਬੁੱਕ ਤੇ 1.6 ਮਿਲੀਅਨ ਵਿਊਜ਼ ਸਾਡੇ ਇਸ ਟਾਈਮ ਤੇ ਸੋ ਜਿੱਥੇ ਵੀ ਤੁਸੀਂ ਦੇਖਦੇ ਆ wherever you are watching ਅਕਾਲ ਚੈਨਲ across the world ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਨਿੱਘਾ ਸਵਾਗਤ ਹੈਗਾ ਔਰ ਅੱਜ ਦੇ ਵਿਸ਼ੇਸ਼ ਸ਼ੋਅ ਤੇ ਅਸੀਂ ਇੱਕ ਗੱਲ ਜਿਹੜੀ ਕਰਨੀ ਆ ਉਹ ਕਹਿ ਸਕਦੇ ਵੀ ਉਹ ਗੱਲ ਕਰਨ ਤੋਂ ਵੀ ਝਿਜਕਦੇ ਆ ਮਨਜੀਤ ਉਹ ਹੈ ਮਾਨਸਿਕ ਰੋਗ ਮਾਨਸਿਕ ਬਿਮਾਰੀ ਜੋ ਕਿ ਇੰਗਲਿਸ਼ ਦੇ ਵਿੱਚ ਨੂੰ ਮੈਂਟਲ ਹੈਲਥ ਜਾਂ ਮੈਂਟਲ ਇਲਨੈਸ ਕਰਦੇ ਆ ਇਹ ਕਿਹਾ ਜਾਂਦਾ ਵੀ ਜਿਹੜਾ ਮੈਂਟਲ ਇਲਨੈਸ ਆ ਇਹ ਬਹੁਤ ਇੱਕ ਵੱਡਾ ਸਾਇਲੈਂਟ ਕਿਲਰ ਹੈਗਾ ਜੇ ਆਪਾਂ ਅੰਦਾਜ਼ਾ ਲਾਈਏ ਆਪਾਂ ਜਦੋਂ ਸੋਚਦੇ ਆ ਫਿਕਰ ਕਰਦੇ ਆ ਵੀ ਜਿੱਦਾਂ ਹੁਣ ਇਸ ਟਾਈਮ ਤੇ ਚਾਈਨਾ ਤੋਂ ਉਹ ਵਾਇਰਸ ਆ ਰਿਹਾ ਜੋ ਫਲੂ ਦਾ ਆਪਾਂ ਉਹ ਤੋਂ ਡਰਦੇ ਆ ਆਪਾਂ ਕਈ ਵਾਰੀ ਐਰੋਪਲੇਨ ਚੜ੍ਹਦੇ ਡਰਦੇ ਆ ਵੀ ਸਾਨੂੰ ਸਾਡੀ ਜਿਹੜਾ ਕਿ ਬਹੁਤ ਮਿਨੀਸਕਿਊਲ ਚਾਂਸ ਹੈਗਾ ਹੋਰ ਚੀਜ਼ਾਂ ਤੋਂ ਡਰਦੇ ਆ ਅਸੀਂ ਬੜੀਆਂ ਤਿਆਰੀਆਂ ਕਰਦੇ ਆ ਇੰਤਜ਼ਾਰ ਕਰਦੇ ਵੀ ਇਹ 'ਚੋਂ ਅਸੀਂ ਸੇਫ ਰਹੀਏ ਕਾਰ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਜਾਂਦੇ ਅਸੀਂ ਸੀਟ ਬੈਲਟਾਂ ਲਾਉਂਦੇ ਆ ਵੀ ਸਾਨੂੰ ਪਰ ਤੁਸੀਂ ਯਕੀਨ ਕਰੋ ਸਭ ਤੋਂ ਇੱਕ ਵੱਡਾ ਜਿਹੜਾ ਕਿਲਰ ਹੈਗਾ ਉਹ ਮੈਂਟਲ ਹੈਲਥ ਹੈਗੀ ਡਿਪਰੈਸ਼ਨ ਹੁਣ ਮੈਂ ਵਰਲਡ ਸਿੱਖ ਹੈਲਥ ਆਰਗੇਨਾਈਜੇਸ਼ਨ ਤੋਂ ਡੇਟਾ ਆਈ ਵਾਸ ਲੁਕਿੰਗ ਐਟ ਦ ਡੇਟਾ ਜਸਟ ਟੁਡੇ ਕਹਿੰਦੇ nearly 300 million people across the world of all ages suffer from depression. That's about a third of the world's population. 300 million, not a third, but that's a big number. ਤੇ ਇਹਦੇ ਵਿੱਚੋਂ ਇੱਕ ਹੋਰ statistic ਜਿਹੜਾ ਸੀਗਾ I was shocked by this. ਕਹਿੰਦੇ ਵੀ every year nearly 800,000 people commit suicide. 1 million ਤੱਕ ਵੀ ਤੁਸੀਂ ਕਹਿ ਸਕਦੇ ਆ ਖੁਦਕੁਸ਼ੀ ਕਰਦੇ ਆ or we know that the major reason, in fact the only reason for suicide is depression or some kind of mental illness.
And the weather doesn't help you. I mean, especially
I don't think you commit suicide because
no,
of the
I'm
weather.
just saying it just changes your moods. It does affect you.
It does affect you, but God help us if that was the case. I think everybody in Britain would have committed suicide by now.
Suicide, no.
But no, the weather doesn't push you that far. But sometimes you do feel depressed in this country.
You feel depressed.
We've just been to Spain, so that's why she said that. Yeah. But एक और statistic बहुत जरूरी है खास करके ਜਿਹੜੇ parents हैं 15 to 29-year-olds ਜਿਹੜੇ ਕਿ ਤੁਸੀਂ ਕਹਿ ਸਕਦੇ ਆ youth ਨੌਜਵਾਨ they are the most vulnerable in suicide statistics. Yeah. ਸੋ ਇਹ ਇੱਕ ਸਾਇਲੈਂਟ ਕਿਲਰ ਹੈਗਾ ਪਰ ਇਹ ਵੀ ਸਾਨੂੰ ਪਤਾ ਵੀ 90% ਜਿਹੜੇ ਲੋਕ ਆ 80 to 90% ਇਨ ਦ ਵਰਲਡ ਇਹਦੇ ਵਾਸਤੇ ਕੋਈ ਇਲਾਜ ਨਹੀਂ ਕੋਈ ਟ੍ਰੀਟਮੈਂਟ ਨਹੀਂ ਹੁੰਦੀ ਕਾਰਨ ਕਈ ਆ there's lots of different reasons health care obviously facilities ਨਹੀਂ ਹੈਗੀਆਂ but even in mid income countries ਜੋ ਗਰੀਬ ਮੁਲਕਾਂ ਦੇ ਵਿੱਚ ਤਾਂ ਕੋਈ ਹੈਲਥ ਕੇਅਰ ਵੀ ਹੈ ਨਹੀਂ but even in mid income countries 80% ਤੱਕ ਕੋਈ ਮੈਂਟਲ ਹੈਲਥ ਪ੍ਰੋਵੀਜ਼ਨ ਜਾਂ ਐਕਸੈਸ ਨਹੀਂ ਕਰਦੇ ਉਹਦੇ ਦੋ ਰੀਜ਼ਨਸ ਹੈਗੇ ਇੱਕ ਤਾਂ ਪ੍ਰੋਵੀਜ਼ਨ ਪਰ ਦੂਜਾ ਹੈ ਵੀ ਸਟਿਗਮਾ ਬਹੁਤ ਜ਼ਿਆਦਾ ਲੋਕੀ ਡਰਦੇ ਆ ਈਵਨ ਇਨ ਡਿਵੈਲਪਡ ਕੰਟਰੀਜ਼ ਪੀਪਲ ਆਰ ਅਫਰੇਡ to be labelled mentally ill or depressed. So ਇਹ ਬਹੁਤ ਵੱਡੇ ਚੈਲੰਜਸ ਹੈ ਕਿ ਸਾਡੀ ਕਮਿਊਨਿਟੀ ਵਿੱਚ ਮੈਂ ਵੀ ਇੱਥੇ ਤੱਕ ਮਨਜੀਤ ਕਹਿਣ ਨੂੰ ਤਿਆਰ ਹਾਂ ਮੈਂ ਝਿਜਕਦਾ ਨਹੀਂ ਵੀ ਜੇ ਸਾਡੇ ਘਰਾਂ ਦੇ ਵਿੱਚ ਬਹੁਤਾ ਕਲੇਸ਼ ਵੀ ਹੁੰਦਾ ਨਾ
ਜੀ
ਤੇ ਇਹ ਮੈਂਟਲ ਹੈਲਥ ਕੋਈ ਨਾ ਕੋਈ ਇਹਦੇ ਵਿੱਚ ਰੀਜ਼ਨ
ਹੈਗਾ
ਸੋ ਅਸੀਂ ਏਡਾ ਵੱਡਾ ਇਸ਼ੂ ਹੈਗਾ and so what we're going to do is going to do 3 programs to really try to get to the heart of the problem. Today we've got professionals, we'll introduce them in a minute and we'll discover different aspects, different ways in which we can think about mental health. And ਅਕਸਰ ਅਸੀਂ ਅਕਾਲ ਚੈਨਲ ਅਸੀਂ ਸਿੱਖਾਂ ਦੀ ਚੈਨਲ ਆ ਅਸੀਂ ਗੁਰਮਤ ਪਰਸਪੈਕਟਿਵ ਨੂੰ ਵੀ ਐਕਸਪਲੋਰ ਕਰਨਾ ਕਿਉਂਕਿ ਇਹਦੇ ਕਈ ਪਰਸਪੈਕਟਿਵਸ ਹੈਗੇ ਆ ਤੇ ਆਪਾਂ ਫਿਰ ਫੋਲੋ ਅਪ ਵੀ ਕਰੂੰਗੇ ਪ੍ਰੋਗਰਾਮ 2-3 ਵੀਕਾਂ ਦੇ ਵਿੱਚ ਉਹ ਆਪਾਂ ਫਿਰ ਇੰਟਰਵੈਂਸ਼ਨ ਮੈਥਡਸ ਤੇ ਵੀ ਗੱਲ ਕਰੂੰਗੇ ਔਰ ਫਾਈਨਲ ਤੀਜਾ ਜਿਹੜਾ ਪ੍ਰੋਗਰਾਮ ਹੋਊਗਾ ਮਹੀਨੇ ਨੂੰ ਅਸੀਂ ਇੱਥੇ ਆਡੀਅנס ਲਿਆਉਂਗੇ and ਅਸੀਂ ਓਪਨ ਡਿਸਕਸ਼ਨ ਕਰੂੰਗੇ ਕੌਮ ਵਾਸਤੇ ਵੀ ਆਪਾਂ ਨੂੰ ਹੁਣ ਇਹ ਸਭ ਤੋਂ ਵੱਡਾ ਕਿਲਰ ਸਾਡੀ ਕੌਮ ਦੇ ਵਿੱਚ ਆਪਾਂ ਗੱਲ ਕਰਦੇ
ਕੀ ਕਰਨਾ ਚਾਹੀਦਾ ਹੈ
ਮਨਜੀਤ ਜੇ ਹੁਣ ਇੰਡੀਆ ਦੇ ਵਿੱਚ 2-3 ਬਹੁਤ ਵੱਡੇ ਕਿਲਰਸ ਆ ਪੰਜਾਬੀਆਂ ਦੇ ਇੱਕ ਤਾਂ ਹੈ ਅਲਕੋਹਲਿਜ਼ਮ ਦਾ ਡਰੱਗਸ ਬਹੁਤ ਵੱਡੀ ਆ ਉਹ ਵੀ ਮੈਂਟਲ ਹੈਲਥ ਕਰਕੇ ਹੀ ਹੈਗਾ ਇੱਕ ਹੈਗਾ ਆ ਫਾਰਮਰ ਸੁਇਸਾਈਡ ਤਾਂ ਉਹ ਵੀ ਬਹੁਤ ਮੈਂਟਲ ਹੈਲਥ ਆ ਤਾਂ ਤੀਜਾ ਜੇ ਭਰੂਣ ਹੱਤਿਆ ਵੀ ਹੁੰਦੀ ਨਾ ਤੁਸੀਂ ਯਕੀਨ ਕਰੋ ਮਾਰਦੇ ਤਾਂ ਅਨਬੋਰਨ ਚਿਲਡਰਨ ਜਾਂ ਬੇਫੀਟਸ ਉਹ ਵੀ ਮੈਂਟਲ ਹੈਲਥ ਕਰਕੇ ਹੁੰਦਾ ਕਰਕੇ ਜਿਹੜਾ ਪ੍ਰੈਸ਼ਰ ਪਾਇਆ ਹੁੰਦਾ ਮਾਮਾ ਤੇ so it's a huge problem and we hopefully will raise the profile so delighted to have some great professionals I think we'll introduce them and get on with the show so ਜੇ ਮੈਂ ਸੱਜੇ ਹੱਥ ਤੋਂ ਸ਼ੁਰੂ ਕਰਾਂ really delighted. On the far side, we've got Dr. Avtar Singh, who is a GP, working in the West Midlands. Next to Avtar, we've got Jaswinder Kaur, who is a professional counsellor. Jaswinder originally from Malaysia, but now works in the UK. And next to Jaswinder, we've got Dr. Ravjot Kaur, who is a psychiatrist. Also on the phone, we've got Dr. Deepa Apte, who is a medical doctor and also Ayurvedic practitioner. We'll be hearing from Deepa as well on the calls. And if I turn to my left-hand side, सब तो पहला मेरे बहुत सत्कारयोग मेरे फिर मेरा colleague मैं कहता हूँ ना Davinder Singh Panesar, who he's a psychotherapist, but he's leading a new field of psychotherapy, if you like, which is Gurmat, psychosocial interventions. And one of the Nali, Pushpinder Sanghera, who is the director of the Center for Mindfulness and Holistic Health and Wellbeing, and she's also developing the Gurmat perspective. So, sare main bhainan nu ta veeran nu fateh bulana, and we'll start with the show.
Waheguru ji ka khalsa, Waheguru ji ki fateh. Deepa.
Hanji. So Deepa ji, because you're on the phone, so we'll start with you. As I said, you're a medical doctor, but you're also an Ayurvedic practitioner. So if somebody with mental health problem or depression comes to you, what perspective do you take on that?
Of course, coming from a medical background, but more importantly from a point of view of Ayurveda and yoga, anyone coming with any kind of mental health illness or imbalance, we actually look at it from a more holistic point of view. And in Ayurveda, we have this saying that first of all, find out the cause for what is causing it. And then thereafter, then we look into the symptoms. And hence, very important is first of all looking into the causative factors and understanding how that is working. And bearing that in mind, in Ayurveda, we say that the moment someone starts repressing their, their emotions, and when they don't show it out, and if they are not able to talk about it, then that will then affect the mind, and of course through that the body, and will show up as either depression or other mental health illnesses and conditions.
Yeah. Dr. Deepa, if I could just ask you one thing. I don't know a lot about the Ayurvedic system, but one of the things that happens in our community is that the distinction between physical illness and mental illness isn't that clear within the Eastern tradition, and often people who have mental health problems will talk about it as a physical problem. We call it psychosomatic. So what is the Ayurvedic kind of perspective on the separation of the physical and the mental?
First of all, in Ayurveda, we are looking at mind and body as one unit or kind of one system, because the mind automatically affects the body. For example, when someone says, oh yes, I'm not feeling well today, and me as a medical practitioner, if I'm just looking at it as a physical ailment, and if I were to do all the tests and I will not find any changes in the blood test or any kind of scans, then we are looking into the mind, because we believe that even if in the mind a person is not feeling well, then it may show up in the physical side of it, but it always starts in the mind.
Okay, well that's really helpful. We'll get back to you because it's often, my mum used to say, "Meri bakki dokhti," and I used to tell her off, "Mummy, teri bakki nahi dokhti, dimag dokhta." But actually, I think that was a Western model that I was applying.
Yeah.
Hanji.
Dr. Avtar Singh ji, I'm going to start off with you. You're a GP, so maybe to first we'll approach to the GP. And so, what is your approach to depression then?
I think so. The distinction's already been made between mental and physical health, and that's a paradigm that is almost imprinted in society. Whether that same paradigm exists in holistic methods, that can be spoken about later, but primarily from a GP perspective.
Yeah, if I came to you on an appointment, because I think that often the GP is the first point of access, isn't it?
I think, and that's the beauty of general practice, is that's you can get to see people in their own kind of setting, in their own community, and I guess it for GPs it's the distinction between what's mental and what's physical. So, for example, the mind impacting the body impacting the mind. If people have had, for example, traumatic upbringings, they can often have quite unexplained pain syndromes, fibromyalgia, sleep problems, irritability, stress, etc. So I think the distinction between the two is very fine and blurred at the same time. But
I don't know what you must have experience with South Asian patients, but my sense is, my instinctive feeling, that they want to come to you for a pill. You know, immediate cure.
Or not. Within South Asian communities, I'd probably say it's more of a taboo subject than it is kind of in Western cultures and societies, and that's the first barrier, is that we often, as families or communities, don't even accept that this could exist on a background of probably
well,
culture.
there's no name for it, first of all.
Well, there's no name for it, and then if you do name it mental, then okay,
pagal.
and then we've created that stigma already, and then there's a shame in that, and then we don't seek help for it.
The Markrab, that's even like a derogatory term, isn't it?
Yeah. So
what do you say in the Punjabi to them?
Yeah.
I think it's first of all breaking down the stereotypes and the stigma, because without those, people won't proceed in their therapy or their whatever it is. We need to address the fears first.
So when people do like they come to you and they say they want medication, and would you actually provide them medication, or would you see the signs? Do they need that medication?
So I guess my job as a doctor is a general practitioner, so frontline kind of medical care is essentially assessing how severe an illness might be, what the risks might
condition
be, and then also taking into account what the patient wants. There are patients out there who don't want to take tablets.
So when you say what the patient wants, so do you go along with the patient, or do you say no?
They want the blue pills.
Yeah.
So the thing is that if I prescribe the blue pills, it doesn't mean they're going to take it.
Right.
So you have to get them on board. And this is where it's about breaking down barriers and making decisions together. So
I mean, we'll come back to the GPs, because I also, because I've done a bit of work in this field myself, I know that the latest kind of developments are what's called social prescribing as well, as opposed to kind of medicine intervention. We'll maybe come back to some of those alternative
so Jaswinder, you're a professional counsellor, so what's your approach to depression?
I think there's a few process here involved as a professional counsellor. I think first of all, the process involves dealing with referrals. So, for example, as a counsellor, we have referrals from doctors, and we don't do any diagnostic. We don't do any diagnostic. It's the doctors that do it. So it's counsellors. We work on people refer to us from medical professional or self-referral. So they're already diagnosed. They're already diagnosed with depression and insomnia, or and we do get mental health. But the other thing that intrigues me, I was just talking to few Dav Paji about this as well. We are very much, the clients that I have are very much involved with medication. As you always said, what pill? The first thing is what color pills. They're very much,
there's a certain color that they actually
I'm not sure. Obviously, it started like that now. Everything is medication.
Like my friend has got this pill, and that really improved her whatever symptoms she had, and they want the same color of the pill.
Angie. So in this thing about mental health, so as a professional counselor, we get the referrals from a doctor. So we the clients that come to us are already diagnosed with depression. However, through the self-referral, people that come without nothing, but they just want. So that thing, because they got sleep problem, something simple. Therefore, I'm depressed. So the simple thing, and they said, I've gone to the GP, and GP will straight away give you the tablets.
But you will go for the causes. You will try. And often there will be other causes, like maybe domestic violence might be a cause, sexual abuse might be a cause, but that's very difficult for people to, kind of speak out.
Yes, it is. But hence, this is where I think, I'm glad you brought that up, this is where the professional counselling comes in. Because as a counsellor, the first thing is the talking. It's like a talking therapy. So that brings out. I think we'll probably go a little bit more into that. But it's all about bringing the awareness of what is going on with that person. But going back to mental health, I was just this is actually I don't know whether you're familiar with the book, the DSM-4. That book that does all the medication and tells you what the medication and for and how much it costs. and the chair of that committee has come up categorically with something like, nobody knows what mental health is. We don't know. We don't know what mental health is.
Well, that's a really interesting point. We can come back to that, because if you look at the history, it keeps changing. The definitions keep, we just call it madness. Nowadays, if you called it madness, then you probably get struck off the kind of register and things,
Yeah, Dr. Ravjot, you're a psychiatrist, and we tend to be fear of psychiatrists. And why do you think
away
this
from the
is?
psychiatrist.
Why
No
do you
one
think
likes
this is?
psychiatrists because we ask a lot of questions. Yeah, psychiatry is a really complex subject. We come to know about
Speaking
it.
Punjabi thoda jiha kyunki
ਹਾਂਜੀ
Yeah,
ਠੀਕ ਹੈ
ਠੀਕ
ਸੋ ਸਾਨੂੰ ਪਤਾ ਲੱਗਦਾ ਜਦੋਂ ਪਰਸਨ ਦੀ ਫੈਮਿਲੀ ਜਿਹੜੀ ਹੈਗੀ ਹੈ ਉਹ ਕਹਿੰਦੇ ਨੇ ਕਿ ਸਾਡਾ ਪੁੱਤਰ ਸਾਡੀ ਧੀ
ਜੀ, ਜੀ।
ਸਾਡੀ ਮਾਂ ਸਾਡੇ ਪਿਓ ਠੀਕ ਨਹੀਂ ਹੈ ਉਹ ਉਸ ਤਰ੍ਹਾਂ ਦੇ ਨਹੀਂ ਸੀ ਜਿਸ ਤਰ੍ਹਾਂ ਪਹਿਲੇ ਸੀ
ਪਹਿਲਾਂ ਸੀ।
ਕੁਝ ਚੇਂਜ ਹੋਇਆ ਹੈ ਨਾ ਸੋ ਉਹ ਚੇਂਜ ਹੋਇਆ either because of their circumstances because of an age milestone and there's many causes for it. So ਜਿਹੜੀ mental health ਹੈ ਉਹ ਮਤਲਬ discriminate ਨਹੀਂ ਕਰਦੀ ਉਹ any time any age ਤੇ ਹੋ ਸਕਦੀ ਹੈ ਨਾ ਬੱਚਿਆਂ ਨੂੰ ਵੀ ਅੱਜ ਕੱਲ੍ਹ ਹੁੰਦੀ ਹੈ ਕਿਉਂਕਿ stresses ਵੱਧ ਗਏ ਨੇ and teenagers ਨੂੰ ਵੀ ਹੁੰਦੇ ਹੈ young adults ਨੂੰ ਵੀ ਹੁੰਦਾ ਹੈ ਨਾਲੇ ਅੱਗੇ ਜਾ ਕੇ ਬੁਢਾਪੇ ਵਿੱਚ ਵੀ ਹੁੰਦਾ ਹੈ
ਪਾਇਆ ਜਾਂਦਾ ਬਹੁਤ ਅੱਜ
ਹਾਂਜੀ ਹਾਂਜੀ and through generations there's lots of different types of pressures ਜਿਹੜੇ ਕਿਆਂ ਨੂੰ ਪਤਾ ਨਹੀਂ ਲੱਗਦਾ so ਸਾਡੇ ਕੋਲ ਆਉਂਦੇ ਨੇ ਜਦੋਂ ਸਾਡੇ GPs ਦੱਸਦੇ ਨੇ ਚਿੱਠੀ ਆਉਂਦੀ ਹੈ ਸਾਨੂੰ ਕਿ this person's experiencing some sort of depression or mental illness and they then they've tried their best and then they come to us or they come through the acute system directly to the ਹਾਂਜੀ directly into the hospital ਕਿਉਂਕਿ ਹਾਂਜੀ ਕਿਉਂਕਿ mental illness ਇੰਨੀ ਵੱਧ ਗਈ ਹੈ ਕਿ family ਨਹੀਂ ਕੋਪ ਕਰ ਸਕਦੇ ਉਹ ਆਪ ਨਹੀਂ ਕੋਪ ਕਰ ਸਕਦੇ ਸੋ ਸਿੱਧਾ hospital ਆ ਜਾਂਦੇ ਨੇ ਜਦੋਂ
ਕੰਮ ਰਹਿ ਜਾਂਦਾ ਉਦੋਂ ਹੀ ਆਉਂਦੇ
ਹਾਂਜੀ ਸੋ ਕਾਫੀ ਸੀਰੀਅਸ ਪ੍ਰੋਬਲਮ ਹੈ ਕਿਉਂਕਿ ਉਹਨਾਂ ਦੇ ਕੰਮਾਂ ਦੇ ਨਾਲ ਕਲੈਸ਼ ਹੁੰਦਾ ਪਿਆ ਉਹ ਘਰ ਵਿੱਚ ਆਰਗੂਮੈਂਟਸ ਹੁੰਦੇ ਪਿਆ
ਆਪਣੇ ਆਪ ਨੂੰ ਵੀ ਮੋੜੇ ਆ ਸਕਦੇ ਜਿੱਦਾਂ ਹੁਣ say I go to the hospital accident emergency department can the family go to the psychiatric hospital and say I'd like to have a voluntary admission can they do that
ਹਾਂਜੀ ਪਹਿਲੇ A&E ਹੀ ਜਾਣਗੇ
ਅੱਛਾ A&E ਜਾਣਗੇ
yes A&E ਹੀ ਜਾਣਗੇ if it's that serious they go there and then they are triaged by a mental health team that is there
ਇਹ ਬਹੁਤ ਜ਼ਰੂਰੀ ਆ
ਹਾਂਜੀ
ਕਿਉਂਕਿ ਜਦੋਂ mental health services ਤੁਸੀਂ ਐਕਸੈਸ ਕਰਦੇ ਨਾ basically actually 3 ਰਾਹ ਆ 2 ਨਹੀਂ 3 ਕਿਉਂਕਿ ਮੈਂ ਵੀ ਇਸ ਫੀਲਡ 'ਚ ਕੰਮ ਕੀਤਾ in the past ਇੱਕ ਤਾਂ ਹੈਗਾ ਆ ਵੀ ਤੁਸੀਂ GP ਕੋਲ ਜਾਂਦੇ ਆ ਉਹ ਡਾਇਗਨੋਸਿਸ ਕਰੋਗੇ ਤਾਂ ਉਹ ਫਿਰ ਉਹ ਅੱਗੇ ਸਪੈਸ਼ਲਿਸਟ ਨੂੰ ਰੈਫਰ ਕਰ ਸਕਦੇ ਆ ਜਾਂ ਦੂਜੀ ਇੱਕ ਤਾਂ ਇਹ ਰਾਹ ਹੈਗਾ ਇੱਕ ਸਲੋ ਰਾਹ ਤੁਸੀਂ ਕਹਿ ਸਕਦੇ ਆ ਇੱਕ ਰਾਹ ਹੈਗਾ ਅਕਿਊਟ ਐਮਰਜੈਂਸੀ ਤੇ ਉਹਦੇ 2 ਤਰੀਕੇ ਆ ਇੱਕ ਤਾਂ ਜੇ ਤੁਹਾਡੇ ਘਰ ਐਂਬੂਲੈਂਸ ਆਉਂਦੀ ਆ ਤਾਂ ਤੁਹਾਨੂੰ ਪਹਿਲਾਂ ਹਸਪੀਟਲ ਲੈ ਜਾਣਗੇ ਉਹ ਤੋਂ ਫਿਰ ਤੁਹਾਨੂੰ ਜਿੱਦਾਂ ਹੁਣ ਕੋਈ ਹਾਰਟ ਦੀ ਪ੍ਰੋਬਲਮ ਹੋਵੇ ਤਾਂ ਉਹਨਾਂ ਨੇ ਫਿਰ ਕਾਰਡੀਅਕ ਨੂੰ ਭੇਜਣਾ ਇਸੇ ਤਰ੍ਹਾਂ ਹੋਗਾ ਇੱਕ ਤੀਜਾ ਰਾਹ ਉਹ ਵੀ ਆ ਕਿ ਪੁਲਿਸ ਵਾਲੇ ਵੀ ਇੰਟਰਵੈਂਸ਼ਨ ਕਰ ਸਕਦੇ ਆ ਔਰ ਸੋਸ਼ਲ ਵਰਕਰਸ ਤੇ ਉਹ ਵੀ ਦੱਸ ਦਿਓ
it must be very difficult for the family as well
let's just get this third
it
one
is yeah so the third one
is important because ਜਦੋਂ ਘਰ ਦੇ ਵਿੱਚ ਕਲੇਸ਼ ਹੁੰਦਾ when there's conflict then often it's the police that gets involved
you're right so what's happened there is ਕਿ community ਵਿੱਚ ਕੋਈ problem ਹੋ ਰਹੀ ਹੈ and ਉਸ patient ਦਾ ਜਿਹੜਾ ਆਪਾਂ ਕੰਮ ਕਰਦੇ ਆ ਉਹ ਕਾਫੀ risk assessment ਦਾ ਕੰਮ ਹੁੰਦਾ ਹੈ ਕਿ ਇਹ person ਨੂੰ risk ਹੈਗੀ ਹੈ ਦੂਸਰਿਆਂ ਨੂੰ risk ਹੈਗੀ ਹੈ ਉਹਨਾਂ ਕੋਲੋਂ yeah so it's risk to self risk to others risk from others yeah so ਜਦੋਂ community ਵਿੱਚ ਕੋਈ problem ਹੋ ਜਾਵੇ ਜਿਸ ਤਰ੍ਹਾਂ street ਦੇ ਵਿੱਚ ਨੰਗੇ ਹੋ ਜਾਣ ਨਾਲੇ ਤੁਰਦੇ ਫਿਰਦੇ ਨੇ ਠੰਡ ਹੈਗੀ ਹੈ ਉਹ neighbors ਤੇ knock ਕਰਦੇ ਪਏ ਨੇ yeah they're disinhibited is that then the neighbors will call the police or the family will call the police and say that this person is at risk
so ਇਹ ਬਹੁਤ ਜ਼ਰੂਰੀ ਆ just summarize that
to the community as well
ਜੇ ਤੁਹਾਡੇ ਘਰ ਦੇ ਵਿੱਚ ਕੋਈ ਵੀ ਹੋ ਸਕਦਾ you know it could be a sibling it could be
could be any age group
ਜੇ ਤੁਹਾਨੂੰ ਮਹਿਸੂਸ ਹੁੰਦਾ ਵੀ ਉਹਨਾਂ ਦੇ ਇੰਨਾ ਸਟੇਟ ਆਫ ਮਾਈਂਡ ਹੋ ਗਿਆ ਵੀ ਉਹ ਆਪਣੀ ਜਾਨ ਲੈਣ ਨੂੰ ਵੀ ਤਿਆਰ ਹੈ ਜਾਂ ਦੂਜੇ ਨੂੰ ਵੀ ਖਤਰਾ ਜਿੱਦਾਂ ਕੋਈ ਅੱਗ ਲਾ ਸਕਦਾ ਘਰ 'ਚ ਮੇਰੇ ਕੋਲ ਕੇਸ ਹੁੰਦੇ ਸੀਗੇ ਹੋਰ ਵੀ ਕਈ ਆ ਦੇ ਮਾਂ ਵੀ ਥ੍ਰੈਟਨਿੰਗ ਟੂ ਜੰਪ ਅਪ ਉਸ ਟਾਈਮ ਤੇ ਤਾਂ ਫਿਰ ਅਕਿਊਟ ਸਿਚੁਏਸ਼ਨ ਦਾ ਤੁਹਾਨੂੰ ਫਿਰ ਪੁਲਿਸ ਵੀ ਇਨਵੋਲਵ ਕਰਨੀ ਚਾਹੀਦੀ ਆ ਬਟ ਆਈ ਥਿੰਕ ਵੀ ਗੋਇੰ ਟੂ ਮੂਵ ਔਨ ਟੂ ਮੇਬੀ slightly different angle now ਆਪਾਂ ਇਹ ਟੱਚ ਨਹੀਂ ਕੀਤਾ ਸੋ ਫਾਰ ਅਸੀਂ ਮਾਈਂਡ ਦੀ ਬ੍ਰੇਨ ਦੀ ਤਾਂ ਬੋਡੀ ਦੀ ਗੱਲ ਕੀਤੀ ਆ ਪਰ ਇੱਕ ਤੀਜਾ ਪੱਖ ਵੀ ਹੈਗਾ ਜਿਹਨੂੰ ਆਪਾਂ ਕਹਿ ਸਕਦੇ ਤੁਹਾਡਾ ਸੋਲ ਤੁਹਾਡੀ ਆਤਮਾ ਨਾ you can decide whether that's separate from the mind but there's the truth is especially ਸਾਡੀ community by South Asian a lot of people are religious they believe in God they believe in a higher being sometimes they come to religion because of mental health problems. Sometimes they can get mental health problems within the religion as well. And I know you've developed a kind of psycho-spiritual Gurmat models. Both of you have been working on that area. So I don't know, Benji, maybe you can just kick off. You know, what is that perspective that you've developed that might be different from the medical model or the social model, if you like, from psychology?
But so, Baji, basically, the centre that we run is a mindfulness, holistic health and wellbeing centre. Now, the centre, what we use there is the actual Gurmat model of health. The interesting thing is
that mind, body and soul connection, is it?
It's all connected.
Yeah.
It is. But the interesting thing is that we have a lot of people, all ages, that come to us when they've actually gone through the medical system and interventions, and unfortunately they're at the stage where they have had enough. So they come to us really to see
to that extreme.
Absolutely. You know, we've had cases where, you know, clients have actually been on depression tablets for a good part of 20 to 25 years, and they're absolutely desperate.
Like an addiction.
So it's like
they're like addicts.
Absolutely, absolutely. And
so ਇਹ ਵੀ ਬਹੁਤ ਜ਼ਰੂਰੀ ਆ ਦਰਸ਼ਕਾਂ ਨੂੰ ਦੱਸਣਾ ਵੀ ਆਪਾਂ ਜਦੋਂ ਅਮਲ ਦੀ ਗੱਲ ਕਰਦੇ ਅਮਲੀ you know, we tend to think about illegal drugs, but the vast majority of drug addicts in the world are those people who are on prescription drugs.
Once you're addicted, it's hard to take them off.
In fairness, Baji, they don't know any different. So they've been so used to taking the same off for so long. So what happens, they come to us, and we, rather than looking at it as a depression, we actually look at the symptoms through our own diagnosis and through our own in-house system.
So what kind of symptoms do you see in people who come to you then?
All sorts, I suppose.
Loss of appetite, you know, but then again, loss of appetite, you know, insomnia.
Suicidal? Are there people who might be contemplating suicide? Are they kind of at the end of the line?
We've had a number of those cases. We've had some extreme cases.
Self-harming.
Hanji, we have, but also interestingly, we get people that come in because they've actually got a spiritual crisis going on, which they themselves don't realise. So there's either this spiritual emergence or there is spiritual emergency.
So they ain't got a clue.
They haven't got a clue.
Well, let me take that point because I know that in say some Christian groups as well, in particularly African church, they do exorcisms and all kinds of so they do have a kind of spiritual model, and you know we tend to think of that as hocus pocus and stuff.
I think the first thing,
but what is the spirit? What is the good? And you've written about Gurmat perspective.
I think the first thing is let's define some things.
Go on then.
Because we're talking about the mind and we're talking about mental health. ਤੁਸੀਂ ਮਨ ਦੀ ਗੱਲ ਕਰਦੇ ਆਪਾਂ ਕੋਈ ਦੱਸ ਸਕਦਾ ਮਨ ਕੀ ਆ? First question, doesn't matter who it is, that's the first question. Jad, if you don't know what the mind is, then how can you tell me what's mental health? Right, that's the first question. So the Gurmat offers us a very clear model, and I think this is the great thing about Gurmat, that it finds us a bridge between a biomedical model and a bridge between the mind. So spirituality and science, a bridge. Because Gurmat gives you a clear definition, man, that you have a man de components kiya, o kam kidda karda ya, jido thoda man and the mind is absolutely connected with your body, exactly what like Dr. Deepa says. So when your mind, home dhira grog daru bhi is mind. We've got the
mind and soul together.
It's your ego. If you want to find sorry, let me just finish.
We've only got 2 minutes to the break. And I'm going to after a bit I will come straight, but I can make out clean. If we've got this beautiful cheese, ਮੇਰੇ ਕੋਲ ਜਿੰਨੇ 80 ਲੋਕ ਜਾਂਦੇ ਆ ਦਵਾਈਆਂ ਖਾਣ ਵਾਸਤੇ ਸ਼ਾਇਦ ਦੂਜੇ ਨਹੀਂ ਖਾਂਦੇ ਜਿਹੜੀ ਸਾਨੂੰ ਦਵਾਈ ਦਿੱਤੀ ਆ ਉਹਨੂੰ ਅਸੀਂ ਪਛਾਣਿਆ ਨਹੀਂ
ਗੁਰਨਾਮ ਇੱਕ ਗੱਲ ਹੈਗੀ ਆ ਅੱਗ ਵਿੱਚ ਹੱਥ ਪਾਣਾ one is to put your hand in the fire one is to learn about the fire right
there's a lot of
difference. What we have done is we have become expert knowledge warriors. We've got great knowledge but very few have wisdom comes through putting your hand in the fire. And the thing is, Gurbani has everything, but we've made it into a part, and which is very important. Right. However, Manajite Jagjit, it's there. It's there. It tells you until you know the mind, you can't go any further.
Okay, we're going to go for a break now. Time flies. Actually, we've gone for half an hour. ਅਸੀਂ ਅੱਜ ਮੈਂਟਲ ਹੈਲਥ ਦੀ ਗੱਲ ਕਰਦੇ ਹਾਂ ਤਾਂ ਸੋ ਆਖਰੀ ਜਿਹੜਾ ਪੁਆਇੰਟ ਦਵਿੰਦਰ ਨੇ ਔਰ ਇਹਨਾਂ ਨੇ ਬੁੱਕਾਂ ਲਿਖੀਆਂ ਇੱਥੇ ਵੀ ਸਾਨੂੰ ਪਿਓ ਦਾਦੇ ਦਾ ਕੋਲ ਦਿੱਤਾ ਖਜ਼ਾਨਾ ਜਿਹੜਾ ਖਜ਼ਾਨਾ ਦਿੱਤਾ
ਉਹ ਅਸੀਂ ਖੋਲਿਆ ਦੇਖਿਆ ਹੀ ਨਹੀਂ,
ਖੋਲਿਆ ਨਹੀਂ ਵੀ ਦੇਖਿਆ। ਤੇ ਜਿੱਦਾਂ ਇਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ ਆ ਵੀ ਗੁਰਮਤ ਇੱਕ ਐਕਸਪੀਰੀਅੰਸ ਦੀ ਗੱਲ ਹੈਗੀ ਆ, ਗੱਲੀ ਜੋਗ ਨਾ ਹੋਈ ਹੈ ਨਾ, ਗੱਲਾਂ ਦੇ ਅਸੀਂ ਗੱਲਾਂ ਬਾਤਾਂ 'ਚ ਰਹਿ ਗਏ। ਸੋ ਆਪਾਂ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਸੋ ਥੋੜਾ ਬਹੁਤਾ ਅਸੀਂ ਹੁਣ models ਦੇ ਜ਼ਿਕਰ ਕੀਤਾ ਵੀ where do these models take us in terms of intervention and what do these professionals do in practice. ਆਪਾਂ break ਤੋਂ ਬਾਅਦ and we will bring Dr. Deepa Apte as well, who as I said is working on Ayurvedic models as well. So ਮਨਜੀਤ ਜਿਹੜਾ mental health problems ਜਾਂ ਸ਼ਾਇਦ ਜਿਹੜੇ ਸਾਡੇ ਵਿਊਅਰ ਆ ਜੀ ਕਈਆਂ ਨੇ ਸ਼ਾਇਦ ਟੈਲੀਵਿਜ਼ਨ ਵੀ ਬੰਦ ਕੀਤਾ ਹੋਣਾ ਵੀ ਚਲੋ ਇਹ ਇਧਰ ਦੇ ਪਾਸੇ ਕਿੱਥੇ ਲੈ ਗਏ ਸਾਨੂੰ ਹਨਾ, ਪਰ ਆਪਾਂ ਨੂੰ ਅੱਖਾਂ ਨਹੀਂ ਮੀਟਣੀਆਂ ਚਾਹੀਦੀਆਂ ਇਸ ਚੀਜ਼ਾਂ ਲਈ। ਜੇ ਆਪਾਂ ਅੱਖਾਂ ਮੀਟਦੇ ਹਾਂ
ਸਾਨੂੰ ਖੋਲ ਕੇ ਸੁਣਨਾ ਚਾਹੀਦਾ,
ਬਿਲਕੁਲ ਜੀ, ਆਪਾਂ ਨੂੰ
ਐਕਸ਼ਨ ਲੈਣਾ ਚਾਹੀਦਾ।
ਸੋ ਆਓ ਅਸੀਂ ਹੁਣ ਬ੍ਰੇਕ ਵੱਲ ਜਾਂਦੇ ਹਾਂ ਤੇ ਫਤਿਹ ਬੁਲਾਉਂਦੇ ਹਾਂ। ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਅਸੀਂ ਜੁੜਾਂਗੇ ਜੀ। ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ।
ਅਕਾਲ ਚੈਨਲ ਦੇ ਸਾਰੇ ਹੀ ਦਰਸ਼ਕਾਂ ਨੂੰ ਹੱਥ ਜੋੜ ਕੇ ਬੇਨਤੀ ਕੀਤੀ ਜਾਂਦੀ ਹੈ ਕਿ ਅਕਾਲ ਚੈਨਲ ਨੂੰ ਚਲਾਉਣ ਲਈ ਤੁਹਾਡੇ ਸਹਿਯੋਗ ਦੀ ਲੋੜ ਹੈ। ਇਸ ਲਈ ਤੁਸੀਂ ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਜ਼ਰੂਰ ਕਰਵਾਓ ਜੀ, ਅਤੇ ਇਹ ਕਰਨਾ ਬਹੁਤ ਸੌਖਾ ਹੈ ਤੇ ਇਹ ਦੋ ਤਰ੍ਹਾਂ ਨਾਲ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਪਹਿਲਾ, ਅਕਾਲ ਚੈਨਲ ਤੇ ਫੋਨ ਕਰਕੇ, ਜਿਸ ਦਾ ਨੰਬਰ ਹੈ 012155110001। ਤੁਸੀਂ ਬਾਈ ਪੋਸਟ ਵੀ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਇਸ ਫਾਰਮ ਨੂੰ ਭਰਨ ਦਾ ਤਰੀਕਾ ਬਹੁਤ ਸੌਖਾ ਹੈ। ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਤੁਸੀਂ ਆਪਣਾ ਨਾਮ ਭਰੋ, ਫਿਰ ਅਕਾਊਂਟ ਨੰਬਰ ਅਤੇ ਇਸ ਤੋਂ ਬਾਅਦ ਸੌਰਟ ਕੋਡ। ਫਿਰ ਫਾਰਮ ਦੇ ਦੂਜੇ ਪਾਸੇ ਜਾ ਕੇ ਆਪਣਾ ਨਾਮ ਭਰੋ, ਪੋਸਟ ਕੋਡ ਅਤੇ ਨਾਲ ਆਪਣਾ ਪੂਰਾ ਐਡਰੈਸ ਤੇ ਨਾਲ ਹੀ ਆਪਣਾ ਫੋਨ ਨੰਬਰ ਜ਼ਰੂਰ ਭਰੋ। ਇਸ ਤੋਂ ਬਾਅਦ ਤੁਸੀਂ ਮਹੀਨੇ ਬਾਅਦ ਕਿੰਨੀ ਸੇਵਾ ਪਾਉਣੀ ਹੈ ਉਹ ਲਿਖੋ। ਫਿਰ ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਤੁਸੀਂ ਮਹੀਨੇ ਦੀ ਪਹਿਲੀ ਤਾਰੀਖ ਜਾਂ 15 ਨੂੰ ਕਰਵਾਉਣਾ ਚਾਹੁੰਦੇ ਹੋ ਉਹ ਲਿਖੋ। ਆਖਰ ਦੇ ਵਿੱਚ ਆਪਣੇ ਸਾਈਨ ਅਤੇ ਡੇਟ ਪਾ ਕੇ ਉੱਪਰ ਦਿੱਤੇ ਪਤੇ ਤੇ ਭੇਜ ਸਕਦੇ ਹੋ। ਸੋ ਆਪ ਜੀ ਅਕਾਲ ਚੈਨਲ ਦੀ ਮਦਦ ਜ਼ਰੂਰ ਕਰੋ, ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਜ਼ਰੂਰ ਕਰਵਾਓ। ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ। ਅਕਾਲ ਚੈਨਲ ਦੇ ਸਾਰੇ ਹੀ ਦਰਸ਼ਕਾਂ ਨੂੰ ਹੱਥ ਜੋੜ ਕੇ ਬੇਨਤੀ ਕੀਤੀ ਜਾਂਦੀ ਹੈ ਕਿ ਅਕਾਲ ਚੈਨਲ ਨੂੰ ਚਲਾਉਣ ਲਈ ਤੁਹਾਡੇ ਸਹਿਯੋਗ ਦੀ ਲੋੜ ਹੈ। ਇਸ ਲਈ ਤੁਸੀਂ ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਜ਼ਰੂਰ ਕਰਵਾਓ ਜੀ, ਅਤੇ ਇਹ ਕਰਨਾ ਬਹੁਤ ਸੌਖਾ ਹੈ ਤੇ ਇਹ ਦੋ ਤਰ੍ਹਾਂ ਨਾਲ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਪਹਿਲਾ, ਅਕਾਲ ਚੈਨਲ ਤੇ ਫੋਨ ਕਰਕੇ, ਜਿਸ ਦਾ ਨੰਬਰ ਹੈ 012155110001। ਤੁਸੀਂ ਬਾਈ ਪੋਸਟ ਵੀ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਇਸ ਫਾਰਮ ਨੂੰ ਭਰਨ ਦਾ ਤਰੀਕਾ ਬਹੁਤ ਸੌਖਾ ਹੈ। ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਤੁਸੀਂ ਆਪਣਾ ਨਾਮ ਭਰੋ, ਫਿਰ ਅਕਾਊਂਟ ਨੰਬਰ ਅਤੇ ਇਸ ਤੋਂ ਬਾਅਦ ਸੌਰਟ ਕੋਡ। ਫਿਰ ਫਾਰਮ ਦੇ ਦੂਜੇ ਪਾਸੇ ਜਾ ਕੇ ਆਪਣਾ ਨਾਮ ਭਰੋ, ਪੋਸਟ ਕੋਡ ਅਤੇ ਨਾਲ ਆਪਣਾ ਪੂਰਾ ਐਡਰੈਸ ਤੇ ਨਾਲ ਹੀ ਆਪਣਾ ਫੋਨ ਨੰਬਰ ਜ਼ਰੂਰ ਭਰੋ। ਇਸ ਤੋਂ ਬਾਅਦ ਤੁਸੀਂ ਮਹੀਨੇ ਬਾਅਦ ਕਿੰਨੀ ਸੇਵਾ ਪਾਉਣੀ ਹੈ ਉਹ ਲਿਖੋ। ਫਿਰ ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਤੁਸੀਂ ਮਹੀਨੇ ਦੀ ਪਹਿਲੀ ਤਾਰੀਖ ਜਾਂ 15 ਨੂੰ ਕਰਵਾਉਣਾ ਚਾਹੁੰਦੇ ਹੋ ਉਹ ਲਿਖੋ। ਆਖਰ ਦੇ ਵਿੱਚ ਆਪਣੇ ਸਾਈਨ ਅਤੇ ਡੇਟ ਪਾ ਕੇ ਉੱਪਰ ਦਿੱਤੇ ਪਤੇ ਤੇ ਭੇਜ ਸਕਦੇ ਹੋ। ਸੋ ਆਪ ਜੀ ਅਕਾਲ ਚੈਨਲ ਦੀ ਮਦਦ ਜ਼ਰੂਰ ਕਰੋ, ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਜ਼ਰੂਰ ਕਰਵਾਓ। ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ। ਅਕਾਲ ਚੈਨਲ ਦੇ ਸਾਰੇ ਹੀ ਦਰਸ਼ਕਾਂ ਨੂੰ ਹੱਥ ਜੋੜ ਕੇ ਬੇਨਤੀ ਕੀਤੀ ਜਾਂਦੀ ਹੈ ਕਿ ਅਕਾਲ ਚੈਨਲ ਨੂੰ ਚਲਾਉਣ ਲਈ ਤੁਹਾਡੇ ਸਹਿਯੋਗ ਦੀ ਲੋੜ ਹੈ। ਇਸ ਲਈ ਤੁਸੀਂ ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਜ਼ਰੂਰ ਕਰਵਾਓ ਜੀ, ਅਤੇ ਇਹ ਕਰਨਾ ਬਹੁਤ ਸੌਖਾ ਹੈ ਤੇ ਇਹ ਦੋ ਤਰ੍ਹਾਂ ਨਾਲ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਪਹਿਲਾ, ਅਕਾਲ ਚੈਨਲ ਤੇ ਫੋਨ ਕਰਕੇ, ਜਿਸ ਦਾ ਨੰਬਰ ਹੈ 12155110001 ਤੁਸੀਂ ਬਾਈ ਪੋਸਟ ਵੀ ਕਰਵਾ ਸਕਦੇ ਹੋ। ਇਸ ਫਾਰਮ ਨੂੰ ਭਰਨ ਦਾ ਤਰੀਕਾ ਬਹੁਤ ਸੌਖਾ ਹੈ। ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਤੁਸੀਂ ਆਪਣਾ ਨਾਮ ਭਰੋ, ਫਿਰ ਅਕਾਊਂਟ ਨੰਬਰ ਅਤੇ ਇਸ ਤੋਂ ਬਾਅਦ ਸੌਰਟ ਕੋਡ। ਫਿਰ ਫਾਰਮ ਦੇ ਦੂਜੇ ਪਾਸੇ ਜਾ ਕੇ ਆਪਣਾ ਨਾਮ ਭਰੋ, ਪੋਸਟ ਕੋਡ ਅਤੇ ਨਾਲ ਆਪਣਾ ਪੂਰਾ ਐਡਰੈਸ ਤੇ ਨਾਲ ਹੀ ਆਪਣਾ ਫੋਨ ਨੰਬਰ ਜ਼ਰੂਰ ਭਰੋ। ਇਸ ਤੋਂ ਬਾਅਦ ਤੁਸੀਂ ਮਹੀਨੇ ਬਾਅਦ ਕਿੰਨੀ ਸੇਵਾ ਪਾਉਣੀ ਹੈ ਉਹ ਲਿਖੋ। ਫਿਰ ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਤੁਸੀਂ ਮਹੀਨੇ ਦੀ ਪਹਿਲੀ ਤਾਰੀਖ ਜਾਂ 15 ਨੂੰ ਕਰਵਾਉਣਾ ਚਾਹੁੰਦੇ ਹੋ ਉਹ ਲਿਖੋ। ਆਖਰ ਦੇ ਵਿੱਚ ਆਪਣੇ ਸਾਈਨ ਅਤੇ ਡੇਟ ਪਾ ਕੇ ਉੱਪਰ ਦਿੱਤੇ ਪਤੇ ਤੇ ਭੇਜ ਸਕਦੇ ਹੋ। ਸੋ ਆਪ ਜੀ ਅਕਾਲ ਚੈਨਲ ਦੀ ਮਦਦ ਜ਼ਰੂਰ ਕਰੋ, ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਜ਼ਰੂਰ ਕਰਵਾਓ। ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ। ਅਕਾਲ ਚੈਨਲ ਦੇ ਸਾਰੇ ਹੀ ਦਰਸ਼ਕਾਂ ਨੂੰ ਹੱਥ ਜੋੜ ਕੇ ਬੇਨਤੀ ਕੀਤੀ ਜਾਂਦੀ ਹੈ ਕਿ ਅਕਾਲ ਚੈਨਲ ਨੂੰ ਚਲਾਉਣ ਲਈ ਤੁਹਾਡੇ ਸਹਿਯੋਗ ਦੀ ਲੋੜ ਹੈ, ਇਸ ਲਈ ਤੁਸੀਂ ਡਾਇਰੈਕਟ ਡੈਬਿਟ ਜ਼ਰੂਰ ਕਰਵਾਓ ਜੀ।
Welcome back to a very special one show today. ਅਸੀਂ ਅੱਜ depression, mental health ਤੇ ਗੱਲ ਕਰਦੇ ਹਾਂ, but before we get back to our topic, you know that today is also Brexit Day. Today the UK.
Are they happy or you
unhappy? Well, I was going to say, I'm not sure whether to say congratulations or commiserations, but it depends what side of the argument you are.
Yeah, exactly.
So it is a historical moment for
it is.
both Britain and Europe as well. So let's see where it goes. But we'll just ਅਸੀਂ break ਤੋਂ ਪਹਿਲਾਂ ਗੱਲ ਕਰਦੇ ਸੀਗੇ ਵੀ different models ਹੈਗੇ, ਔਰ ਆਪਾਂ ਦਵਿੰਦਰ ਨਾਲ ਗੱਲ ਕਰਦੇ ਸੀ ਵੀ ਜਿਹੜਾ ਸਿੱਖੀ ਗੁਰਮਤ ਬੇਸਡ ਮਾਡਲ ਆ ਉਹ ਤੁਸੀਂ ਕਹਿ ਸਕਦੇ ਵੀ ਮਨ ਤੇ ਤਨ, ਜਿਹੜਾ ਮਾਈਂਡ ਐਂਡ ਬੋਡੀ, ਤਾਂ ਆਤਮਾ ਦੀ ਵੀ ਗੱਲ ਹੋ ਸਕਦੀ ਆ। ਸੋ ਤੁਸੀਂ ਥੋੜਾ ਜਿਹਾ ਕਹਿ ਰਹੇ ਸੀ ਵੀ ਸਾਡੇ ਕੀ ਵਿਲੱਖਣਤਾ ਹੈ, ਵਾਟਸ ਯੂਨੀਕ, ਸੋ ਆਪਾਂ ਥੋੜਾ ਜਿਹਾ ਪੰਜਾਬੀ ਚ ਵੀ ਜੇ ਗੱਲ ਕਰ ਸਕਦੇ ਹਾਂ।
ਆਈ ਥਿੰਕ ਸਾਡੀ ਯੂਨੀਕਨੈਸ ਇਹ ਆ ਕਿ ਸਾਡੇ ਕੋਲ ਗੁਰਮਤ ਮਾਡਲ ਜਿਹੜਾ ਹੈਗਾ ਨਾ ਕਿ ਹੈਲਥ ਨੂੰ 4 ਹਿੱਸਿਆਂ 'ਚ ਆਪਾਂ ਡਿਵਾਈਡ ਕਰ ਸਕਦੇ ਹਾਂ। ਐਕਚੁਅਲੀ 6 ਹਿੱਸੇ ਆਪਾਂ ਵਿਲ ਡਿਸਕਸ 4। ਮਨ ਵੀ ਹੈਗਾ ਆ, ਤੁਹਾਡੀ ਇਮੋਸ਼ਨਸ ਵੀ ਹੈਗੀ ਆ, ਤੁਹਾਡੀ ਫਿਜ਼ੀਕਲ ਹੈਲਥ ਵੀ ਹੈਗੀ ਆ, ਐਂਡ ਤੁਹਾਡੀ ਸਪਿਰਿਚੁਅਲ ਹੈਲਥ ਵੀ ਹੈਗੀ ਆ। ਇਹ ਗੱਲ ਜ਼ਰੂਰ ਆਪਣੀ ਮੰਨਣੀ ਪੈਣੀ ਆ ਕਿ ਵਿਦਆਊਟ ਸਪਿਰਿਚੁਅਲ ਹੈਲਥ, ਜਿਹਨੂੰ ਆਪਾਂ ਟ੍ਰਾਂਸਪਰਸਨਲ ਹੈਲਥ ਕਹਿ ਸਕਦੇ ਹਾਂ, ਇਹ ਇੱਕ ਬਹੁਤ ਵੱਡਾ ਕੰਪੋਨੈਂਟ ਆ।
ਪਹਿਲਾਂ ਡੈਫੀਨੇਸ਼ਨ ਦੀ ਗੱਲ ਤੋਂ ਬੜਾ ਜ਼ਿਕਰ ਕੀਤਾ ਵੀ ਇਹਨੂੰ ਵੀ ਡਿਫਾਈਨ ਕਰਦੇ ਫਿਰ
ਡਿਫਾਈਨ ਵਿਦ ਤੁਹਾਡੇ ਜਦੋਂ ਤੁਸੀਂ ਨੋ ਜਦੋਂ when you're seeking meaning, ਜਦੋਂ ਲਾਈਫ ਅੰਦਰ ਹੁਣ ਡਿਪਰੈਸ਼ਨ ਦੀ ਆਪਾਂ ਗੱਲ ਕਰਦੇ
ਹਾਂ, ਸਾਇੰਟਿਸਟ ਵੀ ਮੀਨਿੰਗ ਹੀ ਲੱਭਦੇ ਆ।
ਹਾਂ, ਪਰ ਲੱਭਾ ਅੱਜ ਤੱਕ
ਬਸ ਲਓ ਤੁਸੀਂ ਲੱਭਿਆ ਮੀਨਿੰਗ।
So you think about it,
meaning of mental,
isn't it? Looking for a purpose.
Yeah, so transpersonal is when you're having a existential crisis. ਜਿੱਦਾਂ ਫਰਜ਼ ਕਰੋ ਕਈ ਬੰਦੇ ਹੈਗੇ ਜਿਨ੍ਹਾਂ ਕੋਲ ਸਾਰਾ ਕੁਝ ਹੈਗਾ।
No, but there is a purpose. You know, your purpose is to heal, isn't it?
But not everybody is aware of
their purpose,
wanting to know about their purpose in this life.
Yeah.
They think that this is life, everything that they can see, hear, and this is it. So when they sometimes experience,
yep,
I am.
You've got medical ethics. You've signed. So what is your purpose to the patient?
For my purpose for the patient is to do that for the best, do the best that I can
heal,
for them,
to make them feel good and make them feel better.
Yeah, but
so where's the tension between?
Well, what I'm saying, no, there is no tension. I think what we're looking at is it's not about necessarily purpose of what you're doing. It is what is the meaning of your life.
Right.
It's when you lose meaning to your life, and that can happen when you're very successful. It's when you realize you've got the cars, you've got everything around you.
Achieve those milestones.
Okay, I'm going to come to Deepa because in some senses, I mean, you're teaching Ayurvedic and yogic methods which are ancient. They go back thousands of years. But some people might say, we've had scientific progress now. We understand how the brain works. We understand the chemistry of the brain. Particularly nowadays with brain mapping, we can even understand almost how the mind works. So how do you justify, offering these ancient methods? They're not validated in any blind controlled trials.
Well, first of all, going back to the whole spiritual kind of health and spiritual model that we were talking about, in Ayurveda, we believe that when we look at our life is like a table with 4 legs. And these 4 legs are very important for the stability of life. And these are body, mind, sensory functions, and the soul. And hence, from an Ayurvedic point of view, when we are looking at even mental health illnesses, we believe that it is the holistic effect of all these various aspects. And coming back to the soul itself, because they were talking about it earlier, that spiritual aspect is also very important, because without that soul, you can't observe or even understand what is happening, or how you can even discriminate or become whole. So that is one thing that we look at it from a point of view of Ayurveda.
But let me ask you as well, the word spiritual, I mean, it's a kind of a fluffy, flowery word. It's a nice word, I love it. But what does it mean? Does it mean there's a God?
Yep.
There's a spirit? Is it a God? What is it?
See, the moment we say spiritual or soul related, it is that little observer from inside that tells you what is right from wrong. That is how we look at it in Ayurveda. And the moment, then that is directly connected to the mind. Because whatever the soul feels will then tell the mind, and then from the mind, the effects are seen on the body. And hence there is a big, deep connection between soul, your sensory function, that is your emotions, your mind and the body. It is all about how you feel from within and how you project it out. That is, of course, a more kind of, Ayurvedic stroke yogic kind of aspect to it. And having said that, of course, that thing about that highest self or the highest creator is also very big from a point of view of yoga. And as we all know in yoga, because we are talking about what is the purpose of life. So first of all, as was said earlier, along with purpose, we're also looking into that meaning of life. Meaning and purpose go together. And from a yoga point of view, that is where then we talk about, rebirth, recycle, life coming and going. And that is where then soul becomes that common factor between what has happened in our last life to this life.
Okay, Dr. Deepa ji,
wants to come in.
I just want to thank you.
Thank you so much.
I know we're going to be getting some more calls, but thank you for joining us.
Thank you so much.
Maybe the follow-up.
Thank you.
Thank you, Dr.
I'd just like to pick up on the point. You threw a bit of a Google with saying that there's not evidence for...
Well, there's not the validation.
I'd actually want to correct that, because I think there are studies now which are decent quality, which are suggest holistic therapies do work, and they work well. And, from my interest in holistic therapies, I'd say they work a lot better than some other therapies that we have in the Western modern sphere. And I'll just give you one example.
Give us an example.
Yeah, I'll give you an example. So if this is not even a study, you can just do this at home. I encourage everyone to do it at home. If you listen to the radio and you've got the news going and it's telling you that Brexit's going to be the end of the world, there's this virus in China that's going to wipe everyone out,
and everything,
and everything else, etc., etc. Just imagine, just feel it within yourself, just feel what's happening inside you. You'll be a bit tense, that heart rate goes, your palms get sweaty, Then I invite you to listen to something else. So, for example, you listen to let's dolphins, speech or dolphin sounds. You'll notice that tension that we carried has automatically just started within even minute, 2 minutes, has started to ease. And this is the where actually the definition of having, if we split mind, body, soul, emotions, etc., etc., even just splitting it makes it easiest for us to comprehend, but actually they're all the same and they're all interlinked. So I think the division is the
Can I ask one more thing? Anybody can pick this one up, because the mind and the brain is complex, and it's phenomenal. We don't understand it. I think we understand it better now than we ever did. But there's this mystery called the placebo effect, which is bizarre. And I've read some latest evidence that even if somebody knows they're receiving a placebo, it still has an effect. Is that the connection we're looking for?
Yeah. Well, look. So I think Benji's okay. So I would say that, look, this demonstrates that perhaps the mind and the brain are different.
Right.
So we shouldn't equate the mind with the brain.
Together.
No? The brain is a functioning organ. I think perhaps the heart, Gurbani talks about Hirda, that the heart has 40,000-50,000 independent sensory neurites. So it thinks for itself. The heart has a brain of its own. Heartfelt feeling. Gut feeling. So now there is enough science to demonstrate that the heart has an electromagnetic field. It impacts things around us. But more importantly, where it comes with placebo is what you believe. There is a sense of self. If you have confidence, the body is a self-healing system. Yeah. It's always been a self-healing system, provided you don't interfere with it. You allow it.
So what sort of messages are you giving?
Well, what Avtar just said, what Gurmat started with, which was when we are looking at what we are being fed all the time, fear language, we are in fear. Nirpo, nirvar, there's the clue. That when you are in fear, your physiology changes.
On the placebo, I mean, what percentage of medicines do you prescribe that are placebos?
Hopefully they're placebo plus. Let's call it placebo plus. Hopefully the medications we give have the benefit of a placebo effect, but also they have an additional kind of biomedical effect as well. Otherwise,
so you wouldn't then get rid of pills altogether?
I was just going to say that. Is it for a long time? So
psychiatrists, I mean, we think about you giving
medication. Medication do have a place. As I said, psychiatry is quite broad. Mental health is a whole spectrum. Depression is a massive spectrum from mild, moderate, severe. So we see the severe cases. So we can confidently say that medication does have a place up to a certain point.
Period of time.
मैं जसविंदर थोड़े को मोड़ के हो ना जिदा आपा पहला गल की थी you're from Malaysia.
English जनना ना समझ.
You come from Malaysia, yeah? Sophisticated people, highly educated people.
Interesting. I don't know, but
we're all educated professionals here, and you know, Sikhs are generally a very well-educated community. But it's not as if mental illness doesn't affect educated professionals as well. So it's not, sometimes we see as a kind of an illness of the kind of, lower classes, but really, so because sometimes it's seen as loss of reason, that people have mental health because they've loss of purpose, loss of reason. But it can affect anybody.
So you're saying, yes, of course, it does affect anyone. And as a professional counsellor, you do see all sorts of clients coming through. And going back to this medication, yes, because we do have low, medium, and complex cases. So complex cases, wherever it comes from, it's already there. There is a label. Whether it's schizophrenia, whether it's bipolar, it's already a label there.
Yeah.
And they do need, and through episodes, I think you guys will know better, through incidents, and it becomes a risk to the clients, and so they go on medication.
So what type of people do come to you as patients?
Right from somebody who's got just problems, relationship problem.
Could be across the board.
Relationship, husband,
sexual
wife,
health, sexual, mental health.
Yes,
gender issues. Subject in
gender issues, and as a professional counsellor, I tend to try to get, at the moment now, I'm on this Gurmat journey. For 2 years now, I'm on this Gurmat journey. And I try and implement that.
Okay, and I'll pause you there because I've got a call on the line, and then I want us to take us onto the Gurmat model if we can, because a lot more to uncover. So, Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Hello Ji.
Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.
ਭੈਣ ਜੀ ਤੁਹਾਡਾ ਸਵਾਗਤ ਹੈ, ਤੁਸੀਂ ਨਾਮ ਦੱਸੋ ਤਾਂ
ਮੇਰਾ ਨਾਮ ਹੈਗਾ ਨਿਰਮਲ ਘੁੰਮਣ
ਜੀ। ਨਿਰਮਲ ਜੀ ਕਿੱਥੋਂ ਕਰਦੇ?
ਮੈਂ ਇਹ ਤੁਹਾਨੂੰ ਪੁੱਛਣਾ ਚਾਹੁੰਦੀ ਹਾਂ ਕੁਐਸਚਨ. I mean, obviously I'm a qualified nurse.
Okay.
But when I had postnatal depression, I had no clues myself.
Okay.
And this is going back when I had my first child. He's 43 now.
Yeah.
And ਤੁਹਾਨੂੰ ਵੀ ਪਤਾ ਹੈ ਜਦੋਂ ਕਈ ਆਪਣੇ ਲੋਕ ਉਦੋਂ ਐਸਟੈਬਲਿਸ਼ ਵੀ ਨਹੀਂ ਸੀ, ਕੁਝ ਵੀ ਨਹੀਂ ਸੀ. Even being a qualified nurse, I had a clue what to do.
Yeah, in those times,
postnatal depression, ਸਾਡੇ ਇੰਡੀਅਨ ਜਿੱਦਾਂ ਕਹਿ ਦਿੰਦੇ ਸੀ ਕਿ ਤੁਸੀਂ ਆਦਮੀ ਨੂੰ ਕਹਿ ਦਿੰਦੇ ਆ ਵੀ ਮੈਂ ਫੀਲ ਰਾਈਟ ਨਹੀਂ ਕਰਦੀ, I'm not, they don't listen to you. All they do is ਸਾਡੀ ਮਾਂ ਨੇ ਵੀ ਬੱਚੇ ਜੰਮੇ ਆ, ਉਹਨੂੰ ਤਾਂ ਏਦਾਂ ਹੋਇਆ ਨਹੀਂ ਸੀਗਾ. So really,
because they didn't have no words for it, and they didn't know, what was it?
Actually hit or focus a little bit. Antenatal.
Definitely. Thank you for touching on that.
Anybody want to pick this up on the postnatal?
क्योंकि मां दी समझ नहीं हैगी लाइक करके. ਮਨ ਨੂੰ ਸਮਝਣਾ ਪੈਂਦਾ ਆ ਤੇ ਗੁਰਬਾਣੀ ਦੇ ਵਿੱਚ ਇਹੀ ਆ ਨਾ
ਇੱਕ ਸ਼ਬਦਾਂ ਦਾ ਮਨ ਸਮਝਾਉਣ ਕਾਰਨ ਹੈ ਕਿ ਨਾ
ਹਾਂਜੀ
ਕੁੱਟ ਮਨ ਕਸਵੱਟੀ ਲਾਏ ਮਨ ਦੇ ਨਾਲ ਲੜਾਈ ਸਾਰੀ ਮਨ ਦੀ ਆ
Penji is absolutely right. Look, you know, when after birth ਹਾਂਜੀ ਜਦੋਂ after birth ਆਪਾਂ ਜਦੋਂ ਜਨਮ ਤੋਂ ਬਾਅਦ there is an emptiness.
Of course
there is an emptiness. ਇਹ natural ਆ ਕਿ ਤੁਸੀਂ ਉਦਾਸੀ ਵਿੱਚ ਜਾਣਾ ਹੈ natural ਆ ਪਰ ਸਾਡੇ ਕੋਲ ਸਿਸਟਮ ਵੀ ਸੀਗੇ ਜਿਹੜੀਆਂ ਪਿੰਨੀਆਂ ਦੇਣੀਆਂ ਜਿਹੜਾ ਮਾਲਿਸ਼ ਕਰਨੀ
ਜਿਹੜੀ ਖੁਰਾਕ ਹੁੰਦੀ ਸੀ
ਕਿਉਂਕਿ ਉਹਦੇ ਨਾਲ ਬੋਡੀ ਹੀ
ਕੰਪਨੀ ਦੇਣੀ ਕੰਪਨੀ
ਦੁੱਖ ਕਰਨਾ ਨਾਲੇ ਕਿਉਂਕਿ ਸਾਡੀ we had extended families we were able to support each other ajkal people are vichare they are on their
isolated ho gaye
isolated in fact loneliness any ਵੱਡੀ problem ਆ ਰਹੀ ਆ ਸਾਡੇ ਵੱਲ ਕਿ it is one of the primary cause of illness and depression
ਹਾਂਜੀ
I think that's quite a good example, the postnatal depression, because it actually gives examples of each of these 4 domains that we've touched upon. So, during pregnancy, there are higher levels of hormones in pregnancy than at sort of a non-pregnant stage, which have an impact on the body and the baby and also the mind of the mother. Then the baby's born, baby's
body going in recovery mode as well.
And
trauma.
It's like a trauma, isn't it?
It is a trauma.
And the baby crying like every 3 hours needing a feed, so then mum's going to be sleep deprived as well.
Of course.
So that's the body's changed. And then the stress of being a mother as well. So
okay, I'm just going to bring now because we touched on the Gurmat perspective. ਬਾਣੀ ਕਹਿੰਦੀ ਆ ਜਦੋਂ ਰੋਗ ਗੁਰਬਾਣੀ ਦੇ ਵਿੱਚ ਰੋਗ ਦੀ ਗੱਲ ਆਉਂਦੀ ਹੈ ਨਾ ਕਿਉਂਕਿ ਬਹੁਤੇ ਸ਼ਬਦ ਹੈ ਕਿ ਰੋਗ ਦੇ ਬਾਰੇ ਗੱਲ ਕਰਦੇ ਆ ਉਹ 5 ਜਿਹੜੇ ਵਿਕਾਰ ਆ ਇਹਨਾਂ ਨੂੰ ਰੋਗ ਕਿਹਾ ਗਿਆ ਇਹ ਚੋਰ ਵੀ ਕਿਹਾ ਗਿਆ 5 ਇਹਨਾਂ ਨੂੰ ਕਈ ਰੂਪ ਦਿੱਤੇ ਆ ਕਾਮ ਕ੍ਰੋਧ ਲੋਭ ਮੋਹ ਹੰਕਾਰ this is the root cause according to Gurmat perspective on mental psychological spiritual so Is that where the basis is for your work?
You've got to go one stage behind. ਪਹਿਲੀ ਗੱਲ ਹੈਗੀ ਆ what does ਕਾਮ ਕ੍ਰੋਧ ਲੋਭ ਮੋਹ ਹੰਕਾਰ do to your physiology? ਇਹਦਾ ਜਿਹੜਾ ਕਾਰਨ ਆ it's your sense of self, your ego. It's ਜੇ ego ਨਾ ਹੋਵੇ ਇਹ 5 ਪ੍ਰਗਟ ਨਹੀਂ ਹੁੰਦੇ when ਜਦੋਂ ਤੁਸੀਂ ਕਾਮ ਦੇ ਵਿੱਚ ਆ ਜਾਂ ਤੁਸੀਂ ਕ੍ਰੋਧ ਵਿੱਚ ਆ your mind body changes so now tera parasympathetic system is on your vagus nerve has been stimulated you go into stress mode
so this is all measurable you've measured all these effects
of course so you can look at blood pressure you can look at heart rate you can look at cortisol you can look at adrenaline 50-60 different biochemical changes take place like that ਉਹਦੇ ਨਾਲ ਤੁਹਾਨੂੰ sleep ਕੀ ਹੋਣਾ what reason you don't so there is a question which what causes depression it's a very interesting question because you can see the reason you are sleep deprived is one your blood rate's up your glucose is all over the place up ਹੀ ਨਹੀਂ ਤੁਸੀਂ ਸੌਣਾ your appetite goes ups and down so you can demonstrate kaam krodh lobh hankar changes your physiology measurable through science so it brings mind and the biomedical model together.
Now there's evidence to say there's now evidence to say that simple emotions such as sadness broadly affects your lungs and anger is linked to the liver.
Right.
So we've got that far now.
The Chinese have been saying that for several years.
For centuries.
But I mean, I don't know when you did your medical medicine Avtar. Were you taught any of this? Were you taught any of this? Is it taught in medical school now?
Not directly. Like if I had 1 lecture or 2 lectures in the space of 5 years, and we did have lectures every day from 9 till 6. That's the impact of like work we had. You'd be lucky if you received that. I think Maharaj Kirpa, it's just an interest I've developed after qualifying. So,
but how do you then? I mean, look.
Saji wasta kidda sakde sort of.
Because as you're a professional, you've been trained with a particular paradigm, yes, and you're a Gursikh as well. It's a different paradigm. And Sikhi is not just for Sikhs, is it? Guru Nanak's not, Gurbani is not for Sikhs. Gurmat is for humanity. So how do you then reconcile? I mean, how do you kind of reconcile these 2 different paradigms when you're working with patients who may not even be Sikhs?
Exactly.
You can talk to. You mentioned about God and spirituality. So God is quite an emotive word. It's an impactful word, and people. If you say God, they already have preconceptions about what God is. And I would say to you, you can talk about God, you can talk about Gurmat, Guru di Mata, without mentioning Gurmat or God. And in doing so,
you don't use a label, but you can talk.
So you got
talk to them in the way that they understand.
The way you
you're a practicing Gursikh as well.
That's right.
And I'm probably sure that some of your patients would see that as well. So how do you separate or not separate these two?
Yeah, as a doctor, ਤੁਸੀਂ ਆਪਣਾ ਜਿਹੜੇ views ਹੈਗੇ ਨੇ ਉਹ ਤੁਸੀਂ impart ਨਹੀਂ ਕਰ ਸਕਦੇ ਹੋ really.
Exactly.
ਇਹ ਨਹੀਂ ਹੈ ਕਿ ਤੁਸੀਂ questions ਨਹੀਂ ਪੁੱਛ ਸਕਦੇ ਤੁਸੀਂ ਨੂੰ ਕਿ ਤੁਸੀਂ ਕੀ ਸੋਚਦੇ ਹੋ ਮਤਲਬ ਤੁਹਾਨੂੰ ਕੀ help ਦਿੰਦੀ ਹੈ ਲਾਈਫ ਦੇ ਵਿੱਚ ਹੈ ਨਾ. ਸੋ ਸਾਡੇ ਕੋਲ ਟਾਈਮ ਹੁੰਦਾ ਇਹ ਚੀਜ਼ਾਂ assess ਕਰਨ ਵਾਸਤੇ ਥੋੜਾ ਜਿਹਾ ਸਾਡੇ ਕੋਲ ਘੰਟਾ ਹੁੰਦਾ ਬੈਠਣ ਵਾਸਤੇ to assess the patient to see what's really important to them. Whether it's family, whether it's their vadere, whether it goes to some spiritual person in their society, what their views really are.
But are you possibly, some of the evidence is that the majority of these so-called faith healers are just charlatans, preying on vulnerable people. Are you not just sending them into dangerous situations then by?
No, what works for them. So we see the person as an individual.
So it doesn't matter if that person's a charlatan as long as if they feel that they're doing
ਉਹਨਾਂ ਵਾਸਤੇ ਥੋੜਾ ਜਿਹਾ ਮਤਲਬ ਤੰਦਰੁਸਤੀ ਆਂਦੀ ਹੈ and they're in a mental state which is disturbed, we wouldn't advise them to go there, but we would want to explore that with them.
Oh, that's good. You're exploring with them.
I think Jira, if it's unreasonable to just categorize anything that's alternative as quacks. There is so much evidence there now, so much evidence that cannot be denied. That actually the body is not well understood. It's not well understood. Now there is an understanding which is quite clear that you can take stem cells, you can separate them into 3 places, just change the chemistry and they change into something else. Your mind, the way you think, changes your chemistry. So this goes to show how impactful the mind can be.
Just to the viewers, ਸਾਡੇ ਕੋਲ 5-10 ਮਿੰਟ ਰਹਿ ਗਏ ਆ. ਜੇ ਤੇ ਕਿਸੇ ਨੇ ਕਾਲ ਕਰਨੀ ਹੈ ਹੁਣ ਤੁਸੀਂ ਕਰ ਸਕਦੇ ਆ otherwise we will continue but we will in future programs open up the calls as well. But I just wanted to come back to this really important issue. ਬਾਣੀ ਦੇ ਵਿੱਚ ਕਿਹਾ ਆ ਵੀ ਜਿਹੜੇ 5 ਚੋਰ ਆ 5 ਵਿਕਾਰ ਇਹਨਾਂ ਦਾ ਜੇ ਤੁਸੀਂ ਖਾਤਮਾ ਕਰਨਾ ਜਿਹਨੂੰ tie them down ਖਤਮ ਨਹੀਂ ਕਰਨੇ ਨੇ ਬੰਨਣੇ
ਤਾਂ ਨਾਮ ਜਪਣਾ you have to control them.
ਨਾਮ ਜਪਣਾ and I know you guys do mindfulness. Is that ਨਾਮ ਜਪਣਾ? Is that the same as ਨਾਮ ਜਪਣਾ?
My understanding of meditation, from a Gurbani perspective.
No, meditation is Simran.
Nam Simran is meditation. My understanding through being on the Gurmat therapy, second year, is ke asi eh samjhde hai ke naam japna is what gives you shanti. Naam japna also means ke tusi part kar rahe a bin man baith raha nahi hai, the mind is still doing its thing.
It's wandering.
So naam simran really in the Gurbani, and my understanding and my worldview has completely changed since I've been on Gurmat therapy, is naam simran
yani concentration
ke man nu bitalna, man nu ਤੁਸੀਂ ਪਛਾਣਨਾ actually ਮਨ ਕਰ ਕੀ ਰਿਹਾ ਆ.
Avtar, are you
and ਟਿਕਾਣੇ ਲਿਆਉਣਾ ਮਨ ਨੂੰ.
ਹਾਂਜੀ.
Avtar, you wanted to come in there?
So the question we talked about before is kind of the purpose of life. Who is God, Hannah? If we and like I said before, if you say God to someone, they've automatically got a picture with a white beard in heaven. If I say to you Part, if I say Simran Karnaya, if I say Sangat Karniya, you've already got these preconceptions in there. So the question is, it doesn't matter what I think is Simran or what does our Guru say is Simran, Hannah? And actually we have to live our life and our well-being through their eyes and their mat. Is Guru di mat, this is not our mat, Hannah. So
can I suggest something? I think, look, the Guru's mat is Apte Pachana, to recognize yourself. Apa Rabnu, we're trying to find God, but we don't know who we are.
ਆਪਾਂ ਬਾਹਰ ਲੱਭਦੇ ਆ ਪਰ ਸਾਡੇ ਅੰਦਰ ਹੀ ਆ. It's inside you.
ਆਪਣੇ ਵਿੱਚ ਰੱਬ ਲੱਭੋ.
Khoj, that's the whole point of Khoj.
Bande khoj dil roj. Gurbani chanda na, that doesn't mean take your heart out and have a look at it. It means going within. But we are not taught. So when we talk about Naam Simran or Simran, it is about andarli khoj karni. Ode naal man di pehchan hundi, you begin to recognize what the mind is doing. And look, the psychiatrist, with greatest respect, or the doctor, or even me, or Push, or anyone else, or Jasmine, ਅਸੀਂ ਦੂਜੇ ਨੂੰ ਠੀਕ ਨਹੀਂ ਕਰ ਸਕਦੇ। ਬੰਦਾ ਆਪਣੇ ਆਪ ਹੀ ਸੁਧਰਦਾ ਜਦੋਂ ਮਨ ਦੀ ਥੋੜੀ ਸਮਝ।
ਸਾਡੇ ਕੋਲ ਹੁਣ 5-7 ਮਿੰਟ ਰਹਿ ਗਏ, ਤਾਂ ਮੈਂ ਚਾਹੁੰਦਾ ਵੀ ਅਸੀਂ ਥੋੜੇ ਮੈਸੇजेस ਜਿਹੜੇ ਸੰਗਤ ਨੂੰ, ਆਡੀਅנס ਨੂੰ ਮੈਸੇਜ ਦੇ। ਸੋ ਮੇਬੀ ਵੀ ਕੈਨ ਸਟਾਰਟ ਵਿਦ ਯੂ ਰਵਜੋਤ। ਤੁਸੀਂ ਕਿਹੜਾ ਮੈਸੇਜ, what messages would you like to convey to the viewers about, mental health and particularly anything that you feel is important,
I think ਆਪਾਂ ਬਾਹਰ ਬਹੁਤ ਦੇਖਦੇ ਹਾਂ, ਦੂਸਰੇ ਵੱਲ ਬਹੁਤ ਦੇਖਦੇ ਹਾਂ, ਹੈ ਨਾ। ਨਾਲੇ ਜਿਹੜੇ ਫਿਰ ਪਰਸਨ ਹੈਗਾ ਜਿਹਦਾ ਮਾਈਂਡ ਥੋੜਾ ਜਿਹਾ all over the place ਹੈਗਾ, he doesn't know where to start, ਉਹਨੂੰ ਪਤਾ ਨਹੀਂ ਹੈ ਕਿ ਕਿੱਥੇ ਸ਼ੁਰੂ ਕਰਨਾ ਹੈ ਨਾ। ਸੋ ਗੁਰਬਾਣੀ ਮਤਲਬ ਸਾਨੂੰ ਟੂਲ ਦਿੰਦੀ ਹੈ, ਸਿਮਰਨ ਜਿਹੜਾ ਹੈਗਾ ਬਹੁਤ ਸਿੰਪਲ ਬਣਾ ਦਿੰਦਾ। ਸੋ ਲੈਟਸ ਕੀਪ ਥਿੰਗਸ very very simple. That's always been my message, because when you're confused, there's lots of things happening in your life. There's a situation that you've never dealt with before, for example, and you're facing it. Stop, keep everything simple, do what works for you, but it comes down to the simplest thing is meditation of some sort. So simran, meditation, whatever you want to call it. Let's just start with breathing. Let's just take it basic.
ਤਾਂ ਇਹ ਵੀ ਨਾ, ਮੈਂ I'm going to give my penny worth। ਗੁਰਬਾਣੀ ਦੇ ਵਿੱਚ ਇਹ ਵੀ ਮਹਾਰਾਜ ਨੇ ਕਿਹਾ ਵੀ ਹਸੰਦਿਆਂ ਖਲੰਦਿਆਂ ਖਵੰਦਿਆਂ ਸਵੰਦਿਆਂ ਵਿੱਚ ਮੁਕਤ ਹੋਵੇ। ਬਾਣੀ ਕਹਿੰਦੀ ਵੀ ਤੁਸੀਂ 24 ਘੰਟੇ ਨਾਮ ਜਪਣਾ, ਯਾਨੀ ਕਿ ਰਿਮੇਨਿੰਗ ਫੋਕਸ,
ਆ ਵੇਲੇ ਜਾਓ ਵੇਲੇ 24 ਘੰਟੇ ਤੁਹਾਡੇ ਮਨ ਚ ਹੋਣਾ ਚਾਹੀਦਾ।
ਤੁਰਦੇ ਵੀ ਨਾਮ ਜਪ ਸਕਦੇ ਆ। It's not as if you have to sit in a room, in a special prayer room to do ਨਾਮ ਜਪਣਾ. It's got to be with you all the time.
Okay, so from a professional counselling point of view, I think when you feel, I think the thing is about the awareness. As soon as you feel that you're not right, I think talk to someone. I know I was going to talk about the mindfulness. I mean, I'm hearing this. There's an assumption that everyone understands Gurbani and so forth. But mindfulness need not be associated in that way. Mindfulness can start from focusing, as a where I learn it first, then later the Gurbani. But mindfulness can start from focusing on something, and that brings out your self-awareness, on where you are with in terms of your thoughts.
Okay, Avtar, some messages, final kind of messages to the
I think the take-home message for me is actually what you said, Uncle G. It's that in the moment of crisis, we need to let people know where to go for help. So you've mentioned the GP, if it's kind of not an acute thing, but even if it's an acute thing, please go see your GP. A&E is an option. Like I say, A&E probably try and relieve the more severe cases to going to A&E, and then you've got the ambulance, you've got NHS 111, you've got Samaritans, you've got these, we talk about social prescription, these kind of allied organisations that support individuals going through crisis. We can probably make it available, helpline numbers.
So that's really important, ਕਿਉਂਕਿ ਆਪਾਂ ਕਈ ਵਾਰੀ ਉਹੀ we reduce it down to ਪਾਗਲ ਆ, ਇਹਨਾਂ ਗੋਲੀਆਂ ਦੇਣੀਆਂ, ਸਾਡੇ ਬਿਜਲੀ ਦਾ ਸ਼ਾਰਟ ਮਾਰ ਦੇਣਾ, ਇਹ ਕਰ ਦੇਣਾ. That's part of maybe
that was the past.
ਅੱਜ ਕੱਲ੍ਹ it's much more nuanced. There variety of interventions and very kind of personalised. It's personalised medicine, isn't it? That's what we're talking about here. Hanji, what message would you like to give?
All is in Hukam. We can't change what is meant to happen. We have to have a level of acceptance. My own personal experience of this and understanding of this was, we have a breath. Sit with your breath, even if it's for 3 to 4 minutes per day, and listen to what the breath is actually doing. Listen to the breath coming in, listen to the breath going out. And you'll become very aware as to what your thoughts are doing. And at that moment, bring your focus back to your breath. 2-3 minutes. That's the only one thing that keeps you alive. And we give it no reverence. So that would be my...
What's 2 or 3 minutes? Nothing, really.
We have time to do
day.
So last minute down. Breath is life.
Life is Pavan Guru. It's not your life. It's not your life. It's your Guru. It's your Guru. The breath teaches you about life.
Your Guru is your life.
Absolutely. I think the message is, look, there is more to health than just the mind and the body, right? Explore spirituality. but explore spirituality. If it feels that there is something going on with you, it is going on with you.
Don't avoid it.
Don't avoid it, and don't necessarily go to individuals who
you need to be a
it.
religious person, a believer, to explore spirituality.
No, absolutely not. Absolutely not. Spirituality, you can have that with a near experience. When you understand your mortality, when you understand life can go like this, you become alive.
Dav mentioned right at the start, you know, you only know how hot the fire is if you put your hand in it. If you want to seek help and you don't want to necessarily go through the normal channels, you know, if someone's gone through a similar situation as you are going through now, friends, colleagues, relatives, whatever, reach out, because you know the person who's put their hand in the fire will also tell you how it got better and how quickly it got better and how they got it better.
I just want to say thank you very much for coming in and sharing your thoughts.
Thank you for having us.
Yeah, absolutely. I mean, you know, there's a lot there, and we could go on. And, we were hoping to talk about some cases as well. Examples. Because to the examples brings it to life. Otherwise, it'll be abstract. Yeah?
Exactly.
But I see, you know, next show ਦੇ ਵਿੱਚ ਆਪਾਂ ਜ਼ਰੂਰ case studies ਵੀ ਲਿਆਉਂਗੇ ਤੇ ਸ਼ਾਇਦ ਕੋਈ ਟੈਕਨੀਕਸ ਵੀ ਆਪਾਂ ਸ਼ੇਅਰ ਕਰ ਸਕਦੇ ਹਾਂ ਜੋ
that'll be good.
ਪਰ ਮੈਂ ਵੀ ਕਹਿਣਾ ਚਾਹੁੰਦਾ ਵੀ ਕਿਉਂਕਿ especially as a man, Asian Sikh man, ਅਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਸਮਝਦੇ ਵੀ ਅਸੀਂ ਬਹੁਤ brave ਹਾਂ, ਅਸੀਂ ਯੋਧੇ ਹਾਂ, but you know we can all have these needs, and I think that ਸਾਨੂੰ ਇਹ ਕੋਈ ਸ਼ਰਮ ਵਾਲੀ ਗੱਲ ਨਹੀਂ ਹੈਗੀ ਜੇ ਸਾਨੂੰ ਸਰੀਰ ਨੂੰ ਕੋਈ ਬਿਮਾਰੀ ਹੁੰਦੀ ਤਾਂ ਦੌੜ ਕੇ ਡਾਕਟਰਾਂ ਕੋਲ ਜਾਂਦੇ ਆ, ਤਾਂ ਮਨ ਤਾਂ ਸਰੀਰ ਤਾਂ ਇੱਕੋ ਹੀ ਚੀਜ਼ ਹੈਗੀ ਆ. ਸੋ look after your body, look after your soul, look after your mind, and I think ਇਹ ਚੜ੍ਹਦੀ ਕਲਾ ਹੀ ਹੈਗੀ ਆ ਜੀ. ਸੋ ਅੱਜ ਦੇ ਸ਼ੋਅ ਤੇ ਇੱਥੇ ਸਮਾਪਤੀ ਆ. ਸਾਰਿਆਂ ਦਾ ਧੰਨਵਾਦ. ਬੋਲਦਿਆਂ ਤਾਂ ਭੁੱਲ ਚੁੱਕ ਮਾਫ ਕਰਨੀ. ਬਿਲਕੁਲ ਜੀ. ਫਤਿਹ ਬੁਲਾਓ. ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ.